Upper cervical injury and management. We are incredibly pleased and honored and tired to be able to report a research article that we published in the Journal of Clinical Medicine 2023 titled Non-Surgical Management of Upper Cervical Instability via Improved Cervical Lordosis. There is very little, and as far as I know, there has never been another paper that has been published to show that upper cervical instability can be managed with conservative treatment. We've done just that. In our office at Katz Chiropractic, we've been seeing these injuries for the last 20 years. We published one of the largest papers actually identifying the parameters of upper cervical instability and the likelihood that it's in an injured population to a non-injured. But the biggest question for 20 years is like, well, what do you do? What we did in our office and what we've been doing for 20 years and what we have seen, and we finally published some of this data into a high impact medical journal, is we looked at how can we and how have we been managing this debilitating injury that many people are suffering with. Our hypothesis was that if someone has an abnormal cervical curve, in order for their neck curve is not in normal position as it's buckled in the mid phase of their neck. In order to keep what's called a horizontal gaze, looking at the horizon, they're doing this. So they're constantly keeping their skull extended, which can irritate some of the upper cervical ligaments. Our hypothesis was if we can improve the abnormal mechanics in the mid-cervical spine and improve the cervical lordosis with utilizing chiropractic biophysics and techniques and images that we found to help us know when and where to adjust and what types of traction and how much we were able to apply to these patients. What we found is that by improving the normal cervical lordosis, we've dramatically decreased upper cervical instability. Now, in this paper, we talk about how upper cervical instability is common in trauma and in car crashes, how it can lead to significant pain. But as you could see, we looked at a number of patients. Many of them had neck pain and weakness, headaches, pain at the base of the skull, head and neck pain, blurred visions. And with our treatment, we minimized most of, if not all, of their symptoms. And we did pre and post imaging using a digital motion x-ray, not just static imaging. And what you can see here is their baseline and their post-intervention. We looked at what's called the ARA, which is the cervical lordosis, and we looked at upper cervical instability tilting to the side. And as you can see on this patient one, their initial upper cervical instability was 6 millimeters to the right with a curve of only 14 degrees. We more than doubled their cervical lordosis, and their instability went from 6 to 1 millimeter. Here's another patient that had only a 4-degree curve. We improved it to 23 degrees. They had 7.5 millimeters of upper cervical instability. After treatment, they had 2. And we did this through a number of patients. These patients were just randomly selected. We took them, we treated them as they got better, we did pre and post, we included them in the study. We are incredibly happy and honored to be able to put this treatment and this pathology into the medical literature to be able to show that this type of problem is a real problem, it's problematic, but can also be helped with the type of treatment that we do in our office and that we published here. If you have any questions, please give us a call. We're more than happy to analyze you and answer any questions that you have. So thank you so much. And if you are suffering with upper cervical instability, you may have been pushed to the side and miss or underdiagnosed. And if you feel that way, give us a call and we can properly analyze you to see if you do or do not have upper cervical instability and if our treatment may or may not be suitable for you. So thank you so much, and we're my wife and I and Dr. Michael Freeman, who was on this paper, who's Doctor of Chiropractic, Master of Public Health, MD, PhD, and Forensic Epidemiologist. We're all really excited and proud of this paper, and we look forward to be able to help more and more patients. So thank you so much.